So the primary outcome was looking at hot flash improvement. So women had reduced moderate to severe hot flashes at all the doses trialed, reduced in 82% by week 4 in the lower dose and 92% by week 12 over baseline. And severity was also reduced. So the lower dose reduced it by about 42% and 59% at week 12. And then the higher dose was more reduction in those outcomes. So the significance really is that this is a molecule that behaves differently from any other that we have on the market for reducing hot flashes. And so the significance really is that we have yet another option that's working at the fundamental pathway that's generating hot flashes in the brain to reduce those symptoms for women. Hot flashes, I think, often are seen as a nuisance symptom, but really they can have a huge impact on quality of life for women, both just in their daily functioning, but they can significantly disrupt sleep, and that can have long-term health impacts. Yeah, so obviously we have a long history with menopausal hormone therapy, which is replacing the loss of estrogen in the menopause. And through that loss of estrogen, that works in the brain to sort of reduce the hot flash pathway through how the brain is signaling, because the brain starts signaling in a very different way in menopause because it's looking for estrogen. Estrogen sort of feeds back on the brain to tell it to not have to signal so much. Um, we have a bunch of medications that were initially for other uses, but we have gotten secondary approvals for hot flashes. So the biggest category of those is like antidepressants or SSRIs. And there are a couple that have sought approval for hot flash. And we're not entirely sure how those are working in the brain to reduce hot flashes. Their effectiveness is somewhat less than some of the newer medications on market. We then have a category of medications called neurokinin or NK receptor antagonists. The two in that category are Veozah and Linquet, but Veozah has been out for a couple of years, and Linquet just recently came to market. And they target very specifically a neuron in the brain called the KNDY neuron or candy neuron, which is sort of transmitting that extra signaling to the hot sensing neurons in the brain. This medication is working a little bit differently in that it's more globally affecting the brain. So it's working through the monoamine system and really sort of increasing serotonin, norepinephrine, and dopamine signaling, and working on the candy neurons to reduce hot flashes. But I think the biggest sort of interesting thing is that many people who are taking medications for hot flashes also have associated symptoms of menopause. So having a medication that just treats hot flashes can be helpful. And those KNDY neuron medications or NK inhibitors are good for that. But what we're really looking at with this medication is it may have more global impacts on things like mood and food cravings and things like that, which can also be part of the menopausal syndrome. And hormones tend to be really good at treating more globally, but a lot of our targeted hot flash medications aren't, and these may have more global impact on how women are feeling in the menopause, as well as reducing hot flashes. Yeah, so, we've gone through the phase 2 trials, which means we're sort of figuring out what's the right dose and what's the safety profile of these medications. So now it's time for larger studies. And these studies really look at effectiveness on a larger scale. So they'll be sized to be able to make really good determinations of just how effective these medications are. It also gives us a larger number of women to look at any possible side effects or concerns. There weren't really any big side effects or concerns seen in the early trials, but of course, more data is always better to sort of confirm that finding. And then after we do those, after those larger trials are done, it's not we because I don't actually fund the research, I just perform it. After those larger trials are done, then that drug can go up to the FDA to look for approval for this indication, and possibly other indications if they get good signal on those.